So thank you for joining this weekend and Saturday. I hope tomorrow is Sunday. We are going to be joining with the demo. So thank you for joining this demo. So this is Jagdish. So today I'm going to take care of the session. So I have 8 years plus experience in that medical coding field. So my last designation is client level auditor. So I worked in the client level as well. So today we are going to discuss about completely on IPDRG related and your questions and your answers and how our classes will be and how the schedule will be and what are all the timings, durations and what we are going to do after the training. So that is the thing we are going to be discuss here. And apart from that, I can understand Telugu, Malayalam, Hindi, English, Tamil. So you can ask your questions in your own language and I'm ready to respond. But after the session, if you are asking your question, it will be a valid, it will be easy to answer all the questions. And if you are unable to speak and unable to unmute yourself, you can use chat box and I'm ready to respond to questions. It's clear, team? Yeah, thank you. Thank you so much. So let's we start with the session like why we need to do IPDRG. I hope any freshers are there before going to start the session. I want to ask some related questions. Any freshers are there? Okay, so if you are a fresher, please wind up this session because it's completely related to who is already working as an experienced candidate in the other specialties. Okay, because those people can able to understand and whatever the difficulties we are facing in coding field, right? Okay, so how the coding job? It is easy, difficult as per your point of view. Whatever the specialties you worked, how did you feel that medical coding field? How did you felt? It's easy, difficult, hmm? Average. Yeah. Okay. So what about overtime? What about overtime? Everyone working with overtime, huh? Oh, yeah, so if you're not working with overtime, no issues, but companies are requested to work extra 1 day, 6 day working, 7 day working, don't take leaves. Huh? Yes, yes, it is. It is common in medical coding, right? It's common in medical coding. We can't. Why? Because there are a lot of requirements are there, lot of production is there, and the companies are limited. If you are going with that, some other companies like IT or whatever it is, we have a lot of companies are ready to provide the softwares, but no, not that much companies are there right now in medical coding. It is a booming. Right now, there is a limited companies which is working in India. So that's why there is a issue with that candidate. They are pushing the candidates, pushing the targets with quality, without quality. We are providing different things. So that is the thing is going on. So that's why they are giving these things. Second thing is in medical coding, lot of specialties are there. HCC, ED, E&M, multi-specialty, denials. In the denial, IP denial, OP denial, pathology, anesthesiology, radiology, surgery. Lot of departments are there. I hope you people are already aware of that. So IPDRG in that specialties are there, but the salary was different for all the specialties. If you're working with HCC, you have a different salary. E&M specialty, different salary, different salary, different salary. It's having different salary. In IPDRG, it is a different salary. So the salary differentiation is there. Okay, so everyone aware of that salary differentiations and based on experience, based on performance, and it will be differ from the company wise also, it will be differ. But compared to other specialties, what about IPDRG? Why they are giving this much salary to IPDRG? Anyone aware of that? Why they are giving this much salary to IPDRG in the short period? Short period means 1 year experience candidates also can able to earn 40K in IPDRG if we shifted to another company. Okay, so why they are giving this much salary to IPDRG? What is the reason you people are thinking? I hope you people are already aware of little bit about IPDRG because that's why you joined in the session, right? That's why you joined in the session. So why they are giving this much salary and up to 2K, 2 lakhs also they are ready to give for the trainers. 2,10,000 they are offering for the trainers. So why they are giving this much salary to the candidates? Any idea? Any idea? Because today I'm not going to take any session demo like that. I want to make you to clear what is IPDRG. You can choose IPDRG or not. The demo is not like that. You should join our course. Complicated. Yes, super. So that's what I'm explaining. The thing is, I don't want to make you to join the course. I don't want to make you to this is our class, this is our demo, you should join, this is the thing. No, I'm not going to do the demo like this. I'm going to do the demo like you should know what is IPDRG. It is suits for me or not. If I taken the training, I can able to get the job or not. If I get the job, I can able to sustain the job or not. That is the mandatory, right? I can able to sustain the job or not. So that is the thing only I'm going to discuss because I'm not ready to take the classes here. For classes, I will take, I have 3 days free sessions are there. And at the time I can able to take the classes because this kind of doubts, clarifications and understanding, we can't able to discuss in the classes, right? Because classes is different to understanding the IPDRG is different. Okay, so here I'm going to make you to understand you can do or not IPDRG for your individual profile. I'm not asking like everyone having the individual profile. It is suitable for you or not. That is the thing I'm going to discuss here. And apart from that, some slide demo, how it will be like that, I'm going to be explained. Okay. So fine. Complexity. Yeah, first of all, Prabhu said that like complexity. What is the complexity? Yes, complexity is there. Yes, definitely complexity is there. What is the complexity? What is the complexity? Any idea about that? Totally inpatient stay. Yes. How it is. The first main issue is revenue changes. For example, I will give you some simple thing. One of the patient came to the hospital for fever. Okay, so he has a fever. He came to the hospital, visited the physician. He given just like take a paracetamol tablet and go in India. How much they need to spend in the consultation fee along with the tablet and all everything? How much they need to spend? They will spend. How much they will spend? As in Indian rupees, not in a dollar. In Indian rupees, how much they will spend for outpatient visit, just for a fever consultation? 500 maximum, max to max it is 800 to 1000, right? It depends upon the specialty. But the same fever, the same paracetamol tablet, it's given in the inpatient visit for a 1 day. The patient came to the hospital for fever. The patient admitted to the hospital. The same physician see, the same medication was given, and he discharged in the hospital for the next day. How much he need to spend? How much he needs to spend in inpatient visit? Bed charges itself 1500. Consultation fee, normal consultation fee is different. If the physician come to in your bed and seen that, that is a consultation fee is different. And if you are nothing is there, you should pay the admission charges. That file creation, admission charges, the file charges, examination fee, that and all, it leads to around 3000 to 4000. Is there any diagnosis change? Is there any other medications they are going to provide for fever? No, you're admitted. So I will give you different kind of medications to you for the fever, like that they are going to provide for this condition. Yes, no, only paracetamol, right? Only paracetamol. Apart from that, they won't give you anything for that one. So, if you went to COVID also, initial days they given only for the paracetamol medications. I hope everyone aware of that, right? The COVID situation also, if you go to the hospital, they will give you whatever the thing, paracetamol 10 tablets, you can take it from the government hospitals. This is the happen. Nothing is changed. Only the stay was changed. IP to OP was, I mean, OP to IP was changed. So the revenue was increased into the 10 times. Now you can understand revenue was increased up to 10 times. So if the outpatient coders are coding the 10 charts, it's equal to 1 chart. You got my point? Revenue, as per the revenue value, if you are coded 10 to 15 charts also, only one patient made the revenue. For example, if we are coded in the outpatient 100 charts, if one patient admitted for CABG procedure, if we are coded CABG in that chart, it will be equal to the 100 patient. It's equal to 100 patient revenue. Everyone agreed that. So now you know that the complexity, it's not about the complexity, revenue changes. About the revenue changes, if you make a single error, it's make you the huge loss for the RCM companies. That's why they are giving more salary to the candidates and they are giving more pressure to the candidates and they are hiring continuously to the inpatient coders. And because there is a lot of vacancies out there, because everyone unable to do IPDRG. First of all, this is the basic thing. no, everyone, it's very difficult to do IPDRG. I'm frankly saying difficult to do IPDRG means you should have proper communication skill and you should have the knowledge to read the documentation. You should have a proper anatomy and physiology documentation, and you should aware of all the medical terminologies as per the physician documentation, physician language, physician language. What is physician language means? For example, if the patient came to the hospital for pus formation, we will call it as pus. But how the physician will document? How the physician will say? Abscess. Abscess. Like that. So you should understand the difference between the language in the medical, in the physician language, that we need to understand. It's needed more in IPDRG. It's needed more in IPDRG. That's why it is difficult, because here they are going to be do lot of critical procedures like CABG, fusion, arthroplasty procedures, bronchoscopy procedures, and lot of minute procedures, embolization procedures, pacemaker procedures, defibrillator procedures. So complete things they are going to be documented into the inpatient visit, because it is possible to do CABG in outpatient. Is it possible to do arthroplasty in outpatient? No. So definitely the major surgeries will be done only in inpatient. So the inpatient should have the knowledge to code the scenario. Inpatient coder have the knowledge to code the scenario. And second thing, why it is different from that surgery to inpatient? Why the surgery also the people are getting high salary, but compared to why that surgery having less vacancies, and why the surgery people are not earning that much IPDRG means, if you are a surgery coder, you can able to code only one set of surgeries. Like if you are coded one series surgery coder, two series surgery coder. You are not going to do other series and all everything, because you are a specialty surgery coder. But inpatient coding, it's not like that. If your target is 15, one chart is sepsis, one chart is CABG, one chart is arthroplasty, one chart is bipolar disorder chart. So you should have a multiple skills to understand the documentation. If people have multiple skills, you should know infectiologist, you are a physiotherapist, you are a psychiatrist, and you are a neurologist, you are a neurologist. So everything you people need to know about the knowledge. That's why they are paying more to the IPDRG candidates. So the main criteria of the IPDRG, if you want to become an IPDRG coder, you should have the knowledge. I hope everyone not having that knowledge, because if you are already working in one specialty, you are planning to shift one specialty to another specialty, you are risking in your life, right? You are risking in your life, right? Already you are settled in one job and you are working with there, you know the formalities and you know everything in that specialty. But now you are enter into IPDRG, you don't know anything about that. Even though whatever we are giving the training and whatever we are giving that one, you are entering in the new life. So you are risking in your life. So you should have the capability to sustain. So you should have the capability to sustain in inpatient coding. So that much strength we should have. That much strength we should have means we should know about what is IPDRG and how I need to learn, what is the priority I need to give for the learning base, and how I need to. First, I am eligible or not. Everyone knows about your thing. I'm not saying after the training everyone will get the job, and or else you can opt the training or not opt the training, that is your wish. But the thing is, if you are having the capability, yes, I'm ready to do the training, I have the knowledge, or else I'm ready to increase my knowledge, or I'm ready to improve my knowledge. I'm ready to improve my knowledge. That candidate can choose IPDRG. You can understand whatever I'm saying. So you people knows yourself. I don't know anatomy and physiology. I'm not ready to learn, or otherwise I'm not ready to. Okay, so this is fine, and I'm working on that. So same like that, IPDRG will be. I can shift. I can earn more now. It won't be happen. It won't be happen. It's required higher knowledge. It's compulsory. It's required higher knowledge compared to other specialty, because here you people are going to be work with that higher revenue chart. Higher revenue chart. For example, if you are making any mistakes, it's making the hospital revenue. It's impacting the insurance company's revenue. Apart from the doctor's revenue, it's impacting everything. If the quality is low, it's impacting your company's revenue. If you're not performing well, the company will take care of you completely. Okay, you can make error. I can do. I can help you. The company will say, any company will do like this. All the companies will do. So the thing is here, what it is, what is the meaning? Performance. Here it makes performance. So if you are ready to do, and if you are ready to opt, and if you are, I'm ready to learn, I have the capability, we can do IPDRG. So now we have an idea, I can do IPDRG or not. It's clear. So before going to enter the session, is there any doubts, any questions related to IPDRG? In your point of view, you have some rumors, right? I know in rumors, lot of rumors are roaming in groups, WhatsApp groups and Telegram groups. You will complete within 10 days, 15 days, 30 days. IPDRG jobs are available. Lot of rumors are there. So if you have any rumors or you have any doubts, any questions related to IPDRG, in anything you have some, whatever silly doubts are welcome. I don't want like more ethical questions, and I want some silly questions. Silly question means, sir, what is this? Whether I can earn or not, I can sustain or not, how much salary they will give. Okay, I can go abroad or not. What is the thing I will get it in if I learn IPDRG? If I go abroad, I will get the job in IPDRG or not. So like that silly questions, warm welcome. Any doubts before going to enter into the session? I want to discuss with that. Some silly questions. Any silly questions are there? Yes, Yuvraj. Yeah, good question. Super. Thank you so much. Yeah, thank you. First of all, I will be explain about that AI involving in medical coding or not. Definitely AI will involve in medical coding. Already it is involved. You are working on that. Some simple example I will tell you. Whenever I started my career, there is a ED projects and radiology projects are there. In the radiology projects, more than 200 people are working. More than 200 people are working. Their target is only for 60 at the time, 2017. Their target is only for 60. Slowly, they reduce the people. Slowly, they reduce the people like 200 to 180, 180 to 160, 160 to 140. And after that, it will become say 250. After when I came to that, there is a 50. There is no project loss. The target was increased up to the 50 candidates up to 160. The target was increased. They remove the candidates, but the project doesn't go. Nothing is there. They have a 50 candidates. They are doing the same target. Same target means not a 60. The 200 people, whatever the target they did, that target the 50 people are doing. What happened in between? What happened there? AI was entered. We are calling as AI, but in medical coding term, we will call as CAC assisted coding. Everyone, I hope you people are aware of that. We have one more webinar is there related to the CAC. I will show you the demo on CAC as well. We are integrated with the CAC also. So I will show you one more demo later. And I will be explaining CAC in computer assisted coding. Computer assisted coding, what they will do, whatever it is presented. For example, left is there, it will be identified left. If chest is there, chest it will be identified. If it is a X-ray, left chest X-ray, it will give you the CPT. So the coder not coding right now, they are just evaluating. Understand my point? Before the people are reading the documentation and coding the conditions, right? Now AI will diagnose, it will give you, check whether it is right or not. If it is right, you can click yes. If it is no, you can click it delete and you can code. So now the people are not coding, just evaluating the documentation. So like that, the coding was entered into the specialty. But what happened to inpatient coding? Still the accuracy is only for 45%. Outpatient setting that accuracy is 93%, but inpatient setting the accuracy is only for 45% because there is a lot of guidelines are there that system don't know which one should be coded, which one should not be coded. I will give you the simple example. I explained about radiology, right? Like left chest X-ray can be coded, but for example, the patient came to the hospital for easy procedure. I will explain that. Drainage. The patient having abscess, the physician doing the procedure for drainage. After the drainage, the physician doing wound vac placement. Okay, so understand my concept. The patient came to the hospital for drainage. The drainage was done, and after that, he placed wound vac. Okay, so in this scenario, I need to code wound vac additionally, but AI will code wound vac because wound vac is there. I will code. You got it? My point? You got my point? They will code drainage as well as they will code wound vac. So this is the issue happen in inpatient visit. So this is the simple scenario. But if it is a complicated scenario, I will explain one example. CABG. CABG is a simple procedure or complicated procedure. Complicated. Okay. So if you are understanding like that procedure, no issues. Just I will explain my point of view as a simple format. For example, the patient came to the hospital for CABG procedure. First, the physician giving that anesthesia and they are placing one IV catheter. They are infusing that infusion. So if major surgery is performed, I need to code anesthesia additionally, but AA will code anesthesia because infusion catheter. If you find out the infusion catheter word, that AA will code. There one error. Next thing is after that, the physician, the general anesthesia, he will do intubation because general anesthesia given now the patient unable to breathe, right? They will do ventilation. Everyone know about ventilation, right? So they will do ventilation. So ventilation need to be coded in this scenario. No, because general open surgery means ventilation is included, but AA will code ventilation. Here the second error. Third error, if they wants to do the CABG, first they need to do the sternotomy, right? What is tomy? That is tomy, ostomy. Tomy. Ostomy is different, tomy is different. Surgical cut. So you need to do the surgical cut. You should do the sternotomy. Okay. AA, what they will do? Sternotomy they will do. They will code sternotomy. So I need to code sternotomy in this procedure. So third error. And next I need to enter into the sternotomy. It's not at all possible to enter into the thing. I need to break the ribs. Right? In CABG, they will do break the ribs. Yes, no. No. Now without breaking the ribs, how you can able to see your heart? Not possible, right? Yes. So they should break the ribs. So what will happen? It will be documented like rib fracture. I mean, rib fracture means intentionally they will do the rib fracture means they will do the sternal saw is there. They'll cut the sternal saw. So they will make separated the ribs. So I need to code the separated ribs separately. AA will do that separation of multiple rib fractures because multiple ribs will be resected, right? So it should be calculated, that procedure as well. Next, after that, I need to resect the arteries, right? So blood supply arteries are there. Without cutting, I can't able to do. And I need to open pericardium, I need to open myocardium and endocardium. Later only I can able to enter into the coronary arteries, right? AA, what they will do? They will put carotid, I mean, pericardiotomy, myocardiotomy, everything they will calculate the procedures. So now you can understand what AA will do, why it's not entering into inpatient visit. Now you got it. So AA can code everything. AA can do because if the term AA feeding is, if the term is there, you can code. That is the command for AA, right? Sternotomy is there, you can code sternotomy. Pericardiotomy is there, you can code pericardiotomy. It will do like that. But it is all inclusive. It is inclusive in this procedure. It is not inclusive in this procedure. AA don't know, right? Who will do that? Coder need to be done. That's why still lot of vacancies are in inpatient and it won't be impact that inpatient DRG coders. Definitely it will be impact that radiology, anesthesiology, pharmacology and surgery coders, but it won't be impact in inpatient coders. You can understand while I'm going to take the classes for USDDS guidelines. USDDS guidelines, we have set lot of guidelines is there. At the time, I will explain why AA won't suits for this because here there is a principal criteria is there in outpatient, like not like that criteria, but here it is a principal guidelines is there, which one should be sequence first, which one should be sequence second. Lot of guidelines are there, so that's why it won't impact in inpatient coding. So that's why most of the candidates are requesting enter into that before going to be sent out, and the people are learning inpatient coding. So AA will involve, it can assist, but it won't be entered. It's already entered. It's not, I'm not saying like it is not entered. It is already is there. It's helping inpatient coder, not replacing the inpatient coder. Now it is clear, ma? Okay. So this is the thing. Yeah. Apart from that, any doubts or any questions? Shall we go with that? Uh, yes, for sure. Mm. Mm. Mhm. Mm. Yes, this is the question. This is the question for everyone's question, not for that your question. It is for everyone question. This question answer is based on your performance. For example, if you are performing well in the training, I will ready to suggest you to go as a some light experience, and we will be suggesting you the companies as well. But your performance is poor and you are unable to perform in our mock interview sessions. At the time, I will recommend you to go as a fresher to start your career as a inpatient coder as a fresher. I would like to recommend if you are 1 year experience, you can try to go as a fresher, but more than 1 year or 1.5 year experience, you should try to work little bit hard. At the time, we can utilize this experience and we can go as an experienced candidate is an inpatient coder. This is completely about your performance base. Got it? Because placement, if I'm going to give you the placement, it isn't easy for me because we are tied up with a lot of companies and lot of managers as well. But later, what will happen if you're not sustained? I'm not able to help you. Manager won't be able to help you. They will remove the company. It is loss for you or me. As per my point of view, join my training. I given the training. I placed you, right? Until the tie-up was completed. So if you are not performing, you can ask, no, no, the company was removed. You are not giving the training properly. If you are saying like that, who, whom you need to blame? For us, you. You got my point? So that's what I'm saying. It's completely related on the performance basis. So I'm not saying like other institute, if you are joined, I will give you the placement 100%. No, it's not at all possible to give you to anyone as a 100% placement. It's common. It's a common thing. It's common thing. So the thing is, it's how about your getting the knowledge from our end. We will increase your knowledge and making into the placements. So I can able to give you the interview questions. I can able to make you the live charts. I can able to provide you the projects recommendations, and we have a part-time projects also. If you are, sir, I done with my training, but I'm not able to do the now I'm not ready with that live projects. If you are ready to provide you the internship training, means I'm ready to provide that part-time projects are available, and we are providing the salaries to the candidates also. That is also I can able to arrange with you. So 3 to 6 months you can work with that, and you can get the live exposure, and later also you can able to enter into the companies. So that is one of the options you can able to get it. Okay. So the thing is, it's purely performance based. It's not about your directly. I can't able to say will place you as a experience as a fresher. It's about completely related to the performance. And apart from that, your profile based as well. If you're CCA certified candidate, you have a lot of opportunities to enter into the companies easily. Because if one of the just a second, one of the CPC certified candidate not performed well, and CCA certified candidate not performed well means I will, if I have a chance to hire one candidate, I will hire CCS candidate. You got my point, right? Both the candidates, CPC certified, voice is not clear. Just a second. Now it is clear. For example, one of the two candidates are there. One is CPC certified, one is CCA certified. Both the people are not performing the interview properly. But I have one option to select one candidate means whom I need to select for IPDRG, CPC or CCS candidate. So now you got it. Why CCS is recommended. All the companies are now requesting to do the CCS only. So CPC now, because there is a lot of issue happened from the AAPCN and lot of certifications errors, recertification issues are happened. So US was asking to do the certification for the inpatient coding to do CCS from the IHIMA end, not from the AAPCN. So that is the issue. The companies are looking for CCS certified candidates. Got it? Yes, Pinjari, you are asked some questions, right? Yes, ma. Yes, ma, you can continue. You can continue. No issues. Yeah, yes, you can continue. That discussion we can able to make it later. Now that internship demo and that is the thing is different. We are completely focused on IPDRG here right now. Okay. Okay. Thank you. Yeah. Yeah, thank you. Mhm. Okay, okay. Okay, okay, fine. Okay, 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 fine. Okay. Mm. Mm-hmm. Mm. Mm-hmm. Okay, okay, okay. Mm. Okay, fine. Sure, of course, we can do that. Sure, of course, we can do that. Okay. So shall we enter into the related? Oh, yes, ma. Yes, Navya. Yes, Navya. Ah, yes, Navya. It is audible. Ah, yes, Megla. Okay. 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 That we can discuss later, ma. Because nowadays the companies are not ready to give you work from home initially. They need minimum 6 month. 6 month you should go to office, and later they are ready to provide you further based on performance. Okay. Fine. Okay. So let's be entered into inpatient coding, and I will give you end of the day, end of the session, I will give you some timing and you can ask your questions, team. So shall we enter into that little bit about the demo? Thank you. So first, what is inpatient? Who will call us inpatient? Okay, so patient stayed in the hospital more than 24 hours as per things. Correct? Okay, I will ask one question. Okay. What is ED? Okay, so let me know whether it inpatient or outpatient. Correct? Everyone can able to see my screen, right? Patient came to the ED for cardiac arrest, transferred to ICU, and CPR was done. After 4 hours, the patient expired. So whether it is inpatient or outpatient. Patient, inpatient, outpatient, transferred to ICU. Okay. So he didn't stay more than 24 hours. So it is inpatient or outpatient. Why it is inpatient? Yes, answer is inpatient. Why it is inpatient? Not C. In ED also they will do CPR, not CPR as the reason. Transfer to ICU. So for example, if the patient came to the hospital for ED, right? If the patient came to the hospital for ED, if I'm going to make the bill charges in the ICU charges, insurance company will pay. First of all, insurance company will pay. No. Patient will pay. Patient will pay. No, he won't pay. Right? So because ICU charges, you people knows about the ICU charges. So It is completely related to, because ICU means it is a intensive care unit admission only, right? So after admission only it is done. So the meaning is the rule is not for the everyone. The rule is not for everyone. So that's what I explained here. If the patient stayed more than 24 hours, at the time only it is inpatient, not like that. That is the first issue. The people are getting rejection from the interviews. That is the first issue. The people are getting rejections in the interviews. You got it. So whoever knows inpatient, they knows very well. It's not the guideline. There is no specific guideline. Like if the patient stayed more than 24 hours, at the time only I need to be considered like an inpatient. This is also inpatient. You got my point. So that is the thing. That is the thing here we are going to be learned. So the thing is, we are in the interview panel. We know what they people need, and we know what is the interviewer expectations. Interviewer expectation is they knows ICD guidelines. Everyone knows ICD guidelines. So they won't ask you question from the ICD guidelines. They won't ask you from the anatomy and physiology. They knows what they want. What they want means they need to know. My voice is not clear. Just a second. So now it is fine. Sound is low. Okay. Just a second. Keep my mic nearby. Okay. So now it is clear. So the interviewer knows the stuff of the candidate. The stuff of the candidate means this is the stuff. This is the stuff. You should know what they don't know. What they don't know. If you are saying like inpatient means always it is 24 hours now, he simply knows he taken training from institute, he came to that attend to the interview. Right? He knows everything, right? Interviewer taking that is he may be a manager, he may be an auditor, he knows everything, right? So the thing is, if the patient not like that, if the patient admitted to the hospital, when the physician documented, if the patient admitted to the hospital, means that is enough to consider a inpatient visit. That is enough to code as a inpatient visit. Clear? It is clear. So can I ask some little bit question related to that? Okay. Yes, Mark. Hmm. 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 That salary details and all everything we can discuss end of the session, Mark. Okay. Yes, that's what now we will discuss end of the session. Now. We started the session. End of the session, we will discuss about your queries. Okay. What is OBS? So now let me know whether it is inpatient visit or outpatient visit. Correct? Outpatient or inpatient? Outpatient. Patient. Inpatient, outpatient. It's not an inpatient visit. It's not a inpatient visit. That's what I said. If the patient stayed more than 24 hours hospital, always it is not a inpatient visit. So I hope everyone aware of the COVID situation, right? COVID situation, if you don't have COVID also, they will make an observation for 7 days or 3 days. So the meaning is you are admitted in the hospital, you are in that admission visit. It should be considered like admission. No, right? So it's that is the meaning. So that's what whatever you are in your mind, it's completely different by the learning of inpatient coding. Okay, so now you got it. It is a observation unit. It is not the inpatient unit. Okay. Ah, yes, ma. Hmm. 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 Yes, when the physician documented, I admitted or otherwise UB04 form was created, insurance form, claim form was created, means that account should be considered like inpatient visit. Got it? Okay. So I will give you one more question to understand about inpatient. Can I give one more question? Can I give or not? Difficulty, yeah. Okay. Okay. So before going to enter into the question, everyone knows about ICD, CPT. What is CPT? Right? We should know about PCS as well. Okay. So when we will use ICD codes for all the conditions, for all the conditions. So outpatient also we will code ICD and inpatient also we will code ICD, right? Okay. So when we will use CPT? Procedure, which procedure? Inpatient procedures or outpatient procedures? Outpatient. So when the patient done any procedures in outpatient services, it should be coded outpatient. So if any procedure performed in inpatient, it should be coded like inpatient. PCS can be coded. So this is the thing you people little bit aware of that, right? So ICD codes can be coded in outpatient and inpatient. CPT should not be coded in inpatient visit, only should be coded in outpatient. PCS coded should be only in inpatient visit. So this is the concept. So I will give you one more question related to that. Okay. What is RCA? Anyone having idea about RCA? RCA. Right. Coronary artery. Okay. So how many procedures performed in this scenario? What are all the procedures? Absolutely. Okay. So now let me know how I need to code this angiography and CABG procedure. What is the code set I need to use for angiography? Correct? Okay. So first of all, my question, this is inpatient visit or outpatient visit? This is inpatient. Yes, exactly. It is inpatient. So now let me know what is the code I need to use for angiography. What is the code I need to use for CABG? This is common scenario in inpatient visit. Hmm? Inpatient PCS and CPT both are, or only PCS are, or only CPT are. PCS with the CPT are. Only PCS are. Okay, so my question is how I need to code angiography, whether it is CPT or PCS, because CABG we know it is PCS. So my question is angiography. Angiography, how it should be coded? Angiography is procedure, not ICD. CPT or PCS? Is PCS. Okay. We code only CABG, yeah. So yes, most of the people having an issues to understand the outpatient to inpatient visit. I will be clearly explain that outpatient to inpatient. When the patient came to the hospital for outpatient services, due to some issue, if the patient moved to inpatient visit, that whole visit consider like a inpatient. You got my point? Whole visit considered like a inpatient because I can't able to charge separately for that outpatient visit and separately for the inpatient visit. So for example, if one of the patient admitted came to the hospital for some condition, he thought I don't want to admit, but the lab test and all everything, something it is uh, suspicious. So he admitted to the hospital. He's taking the thing. So no, first you can clear your outpatient charges, and later only I will make you admit like that. You should pay separately for this because this is outpatient. Like that, if you said like that, you will pay for that. They can do like this. Same like that. It is common. So it's so I can make a two separate billings. I can make it two separate billings. So the whole yes, ma'am. Yes. Hmm. In the same visit, I'm asking about the same visit. The patient came to the hospital for OP. That OP converted to IP. Suddenly means that should be considered like whole visit as an inpatient visit. So the angiography procedure also should be considered like a inpatient coding and it should be considered like PCS. Got it? But angiography done in 2 days before in the outpatient. Now the patient came to the hospital for CABG in inpatient means at the time you don't want to code angiography. That angiography code should be coded in CPT code. Now you understand the scenario. So now you got it. What is inpatient? What are all the difficulties? I hope you people are little bit aware of already know something about inpatient coding, right? You are planning to do inpatient. I hope you people are already checking with your friends and analysis and done with some YouTube channels and lot of things is there. But no one going to be explained in the deeper of the inpatient coding because the inpatient trainers are very less. I'm frankly saying why I'm saying like that now. Already inpatient coders are getting in the lakhs. Why they are going to take training? Simple logic. Simple logic. You can understand because I asked my colleague or and one more thing. My trainer is there. I asked my trainer, sister, I want to take one more batch. So if it is possible to take one batch like that, now she said, yeah, already I'm getting more, so why I need to take another batch? If I ask another one, I'm already getting more pressure in inpatient coding. Why I need to take this training for that one? This is the common thing. Whoever the trainers are very less. The trainers who is taking, they don't have a work exposure. First thing, they don't have a work exposure. If they have a work exposure, they have already having the best salary in the market and they are already having the most stress on their mind. In inpatient coding, already we have more stress on in our mind. It's very difficult to do that inpatient charts on daily basis. So it will get some stress on that. So no one ready to take the training. It is common in that market. If I'm substitute with some other persons also, it takes more costly and as well as it's very difficult to convenience them to take the training. So, but whoever taking the training, just they know the basic concepts about the IPDRG, thus they are saying this is training, this is IP, this is PCS, this is that. Like that, they will explain. And you people also don't know the concepts about that. But once you entered into the office, you people will think whatever they teach is different. That whatever we are understanding that it is different, but working balance is completely different. Here, what we are making the schedule copies, it's completely related how you people are going to be working in the offices. Same like that, we are created the schedule copies for you, and we are scheduling that interviews, mock interviews, and recording sessions. Also, we will provide you. We will provide you the 3M software, which is working in the offices. We will provide you the 3M softwares, and your duration will be 6 months. 6 month means your courses will be completed on 45 days to 60 days. And after that, if you want to attend again the classes, you can attend the classes again. If you are opted weekdays, you can attend in weekend as well. If you are opted weekend, my voice is breaking. Chuchu. Just a second more. I'll make it clear. Now it is clear. Now it is clear. Okay. So here you can able to opt both the sessions. For example, you opted weekday session Monday to Friday, but you are unable to attend the session. You will get the recording session as well. And you can opt, you can join weekend session also. If I want to take more sessions, if I want to attend multiple times for the same thing, if I want to attend multiple times interview sessions, live chat review classes, because you people have 15 days live chat. But if you are want to attend multiple times, we will give you the offer. You can attend multiple times without any cost, any extra cost. You don't want to pay any extra cost and you can continue the session up to 6 months. It is a complete validity you people will get. At the same time, that compared to other thing, we are charging very less also. So the training fee also we will post it in the group as well. I will post one of the link that Monday to Friday you people have a sorry, Monday to Tuesday, Wednesday, you people have a free classes. So in that link will be posted in this group. I shared this group link in that chat box. So just join this group for the separate link because this link will be valid only for today. Because tomorrow we have a CCS session. CCS session also same link, but class link will be different. You people have a Teams link to attend the classes. So in this, I posted the link in the chat box. So just join this link, and in this link I posted the daily classes that Teams link I will post it there. So you will get dedicated mobile application and web application as well. It will be provided you lot of informations to you, and we are uploading the charts as well. We are providing you the recorded sessions and validity and everything whatever you require. We are ready to provide. We are a professionals and we have the more experience in the field also. So your questions and whatever you are asking, we are going to be like in the we are going to teach you what how you can able to understand like that. So comparatively you can just attend the 3 days free session and later also you can able to decide what you want to do continue. It's clear, team? Yes, Aidilu. Yes, Aidilu. Yes, Aidilu, it is audible. Okay, fine, fine. So yes, ma. Yes, please. Yes, Srinivas Rao. Yes, Srinivas. That internship demo we will post you in the different format because our old candidates also wanted to do the internship things. So at the time you can join with that at that meeting. This is only for completely IPDRG. So internship demo will be a different because now we hired only for the internship for freshers, and next month onwards we need around more candidates. So at the time I will post the demo for how to do the internship because last batch itself we done with the demo and we have already 60 candidates for the internship. So now I'm going to make a already old candidates and new candidates demo will be posted in the next week or after 10 days. I will post you for the internship nothing but if you are not ready to if you are suddenly you can't able to relocate or otherwise you want to learn something else from the live charts, you can opt internship. That internship salary will be based on your quality. You can do 4 hours for the charts, 4 hours 10 charts you need to do based on the quality, based on the productions you will get the salary. Simple thing, internship. Yeah, yes. The demo I will be conducted with you because salary is very less on that because you people will get maximum 5,000 to 8,000 for that internship. Not that much. Okay. Okay. So that salary is little bit less on. In the demo groups only we will post. Okay. Fine. So the classes will be start. Yes, ma. Yes, Harish. Yes, we will provide you the 3M software. You can use the 3M tools as well to finding the codes. Hmm. Um, Everything you will get it in your application. It will be a web based application. How you are getting the softwares by like by charts, you are uploading downloading the charts and you are doing from the software same like that. It is a you should log in with your Gmail and with OTP and you can log in and you can take your chart from that course folders, and nearby the software is available. You can code and you can calibrate, and that answers will be shown in the different format. That answers will be available, and apart from that you will get the assessments also, daily assessments, weekly assessments, practice assessments, everything it will be showing with you the explanations. So that also you can able to get it. Okay. Yes. No, 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 ma. we are giving complete training like ICD, PCS, live chat, interview preparation. This is the 4 level things is there. First level is ICD, second level is PCS, third level is live chat, fourth level is mock interview. You people are already learned ICD, so your ICD session will be end of the session. So first you people will start with the basics of IPDRG and PCS. Later we'll go for ICD refreshment training, and later you can go for a interview preparation. So first your course will be, because you are already experienced. I don't want to waste your time, because some people are already getting a better knowledge in ICD. So you people can, that ICD session will, that's why we are scheduled that ICD session in the later. Got it? You people have all the sessions. Anatomy and physiology also we are providing in the free of cost for everyone. If you want, you can join that session also. No issues. Okay. Okay. So yeah, good evening, ma. Mm. Okay. With mm. No, ma, not like that. Actually, that is mentioned there in the website. But the thing is, if you are done with the CCS, if anything is there, we will take care of that, and we will provide you the 240 hours you trained in our institute like that. We need to give the certificate, and it should be uploaded in the website. That is enough. That and all we will take care of that. If you are going to do CCS with us, and we will take care of that everything. Okay, got it. And in the group link I posted there, you can check there and you can join as soon as possible. And the link will be posted there only. Okay, so the coming classes links will be posted there only. Please use that. Anatomy and physiology, we won't take more. I will give you the recording sessions and the materials and assessments. You can do by your own, because you people are experienced. We won't provide specifically for you, but randomly we will take the anatomy and physiology classes with that another trainer. If you want, I will share the schedule. You can join whenever you are free. Okay. Okay. So I don't want to extend your duration. I want to shorten your duration. That's it. Okay. Yes, ma. Yes, ma. 3M leading will be. Yes, yes, yes. You will get the 3M leadings as well. We will give you the individual 3M for 6 months to you. Okay, so you should work out on that. Okay. Yes, you will get the live chat recordings. We will be upload you in the restricted format. Okay. Okay. So the classes starts from that, and your training fee will be connected with your HR team, and you can check with your HR team. And if you are paying in that single attempt, you will get extra 10% discounts also. You can check with the discounts also from the HR team and the fee details and all everything. If you are having any doubts or any questions, please connect it with me, and I'm happy to help you, and we'll meet you on Monday. Okay. So thank you, team. Thank you so much. Thank you for joining this. I hope this session will be making you to understand IPDRG. So it's not recommended to join IPDRG courses. The main thing is you should understand whether you need to choose IPDRG or not. That is the main agenda. Okay. So I hope you people have a little bit clear about I can do or not, right? Okay. Yeah. So thank you, team. Thank you so much. I will be coming in that basic topics will be taken by another trainer, but live chart review and interview preparation and all I will be there, and I will be guiding you to clear your interviews as well. Okay. Yes, classes starts from Monday, ma. Hmm. Weekend class starts from tomorrow. If you are opted weekend class starts from tomorrow, you can let me know separately, and I will be joined. That starts from tomorrow. You can connect with me. I will share the link, man. No issues. Yes, ma. Fee detail we will be posted in group, ma. Okay. Okay. So thank you, team. Thank you so much. Thank you. We'll wind up the session. I posted the link in the group. So before exit the session, you can join this group link. The 3 days link you will get. Thank you, team. Thank you so much. Thank you.